And I always want to call him my nephew, but he's my brother-in-law. He's like 13, and so I just always think in nephew terms, but, but he's my brother-in-law. And I have my iPad, and I was like, hey, check this out, and he's all, what's that? And I go, it's an iPad. And he goes, oh, check this out. He pulls out his PlayStation 2, and like this was like, he just didn't care.
Yeah,
he's like,
whatever.
Yeah, my PlayStation 2 can do this, 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 and this. What about yours? I'm like, all right, I don't have that many games on it. Sorry.
All right.
At any rate, it's time for health.
That's right, and it is common to hear about heart attacks and stroke, but there is another condition that affects your cardiovascular health that you may not know about.
It's called, and I hope I get this correct, Doctor, abdominal aortic aneurysm.
That's correct.
Dr. Alex Harrison, tell us about it.
Thanks. Good to be here. I thought we'd talk about abdominal aortic aneurysm, or often referred to as AAA. It's a condition affecting predominantly men more than females, 4 to 1. And,
really? Wow.
Has been shown to be prevalent in males above 65 years old, about 5 to 10% of the population. What an abdominal aortic aneurysm is as we see here in this graphic, it's a outpouching or enlargement of the aorta, which is the large blood vessel carrying blood from the heart to the body. Generally occurs below the renal arteries, which are those two branches of the arteries taking off in the middle of the abdomen there. And it occurs generally with atherosclerosis. We hear about hardening of the arteries and narrowing of the arteries and heart attacks and strokes, but this is actually an enlargement of the artery, and can be catastrophic if this were to rupture. Oftentimes people don't know that they have these. They're what we call asymptomatic, that they don't feel anything, don't know they have it, but if they were to have problems, they're generally, like I said, they were to rupture and be a catastrophic event,
and
oftentimes
at that point,
death.
it's pretty much too late, right?
Sometimes they have a small rupture and they seal off, and they call what's called a sentinel event, or a warning sign, and you're able to get the patient to the hospital, detect it early enough, and get it treated. But the majority of the cases are not so. So when these are found, it's often incidental. People have a CAT scan of the abdomen for another reason, or an ultrasound of the abdomen for another reason, and it's found incidentally. And what's been recommended is, because of the high incidence in people above 65, particularly in males who have ever smoked in their lifetime, is that there's been a large screening study that showed that males above 65 years of age, between 65 and 75, who have ever smoked, should have an ultrasound at some point to screen for this
What about those CT scans?
Well, CT scans also can detect it, but are more costly, involve radiation, and an ultrasound is simple, painless, no radiation, and less costly.
So would this eventually become something like women get mammograms, and older men, once they get over like a certain age in their 60s, will then just get an ultrasound and see if they have this?
Yeah, women get mammograms yearly. This should be a one-time event.
It's a one-time thing. Okay. So
anybody who's ever smoked and is above 65 should have this checked.
So once you're checked out, then you don't have to get checked again.
Correct.
Okay.
And this is how you fix it?
Yeah, people who have very large aneurysms above 5.5 centimeters are at risk for rupture, and it can be treated one in two ways. The graphic here shows endovascular repair, which is a non-surgical technique where actually you go in through the artery in the groin and implant a covered stent graft that isolates the aneurysm or outpouching from the rest of the artery and seals it off in this manner here. The more traditional approach is an open surgical repair, and that's where a surgeon opens up the abdomen and clamps the aorta above and below the aneurysm, and then opens it up and puts in a graft to seal off that narrowing there. And both are successful. The endovascular repair is becoming more and more common.
The first one?
Yes, because it's less invasive, has a lower risk of complications immediately, doesn't have quite the long-term effectiveness as the surgical repair does, often requires a few more procedures down the road, but like I said, has a better short-term outcomes. And so basically, it's something I wanted the viewers to know about, be able to be screened if they, the viewers out there are above 65, have ever smoked, they ought to have an ultrasound if they haven't had one before.
All right.
If you've got questions, you can send them in from Dr. Harrison at Morning Rounds at KCOY.com, and we'll get those answered for you. Also, if you have some suggestions, like you're thinking, hey, I always want to know this about heart health, send those to us as well. Thank you, Doctor.